You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. With us, we have a periodontist, an expert on the topic, Dr. Bruce Crawford. Dr. Crawford, welcome to the program.
Hi, Randy. Thank you for having me.
Now, for people that don't know, and I have lots of questions, but for people that don't know your practice, who's your typical patient? What are the services you offer? And I guess you're a periodontist.
Yes.
So what type of, who's your typical patient?
Okay. Well, that's a great question. We don't really have a typical patient. We have patients that range from 20 years old to 90 years old. As a periodontist, what I do is I try and help people save their teeth, Randy, and that means people that have bleeding gums, painful teeth, loose teeth, flaring teeth, infections. So those people come to us. Oftentimes they're referred to us by a dentist or a friend or family member. And so we use a dental laser and we're able to help eliminate their infection and disease.
You're big on lasers, right?
Yes, we've been using a laser for over 5 years now. The difference between the laser and the old way, where we used to have to cut and peel the gum tissue off, and there were a lot of stitches and kind of grinding of the bone, it worked, but the laser is the latest technology. It's minimally invasive. We can do the entire mouth in one visit. There's less discomfort. It's amazing how technology with the laser has helped our patients, so they don't have to do it the old way. And really about 90% of periodontists are still doing it the old way.
So it's a bacterial infection. They're cutting back the gums,
yes,
and cleaning out the infection.
Yes.
Where you, I just want to make sure, we've talked on the phone about this.
Yes.
So you're going in with a laser and just killing the bacterial infection.
Right, right.
Is that kind of what's going on?
Yes, yes. I'm sure you're familiar with ophthalmologists. They use a laser and basically it gets rid of the cataracts. It's clearing up the diseased eye. That's what we're doing. We're putting the laser, which is just a little tip, inside the gum. The laser destroys the bacteria, and the bacteria is what causes this infection that they have, that causes them to have the bleeding gums, the painful gums, and the bone loss. So with that laser, we're able to place that in the pocket where the infection is, and we can eliminate the infection and reduce the swelling and problems that they have with the painful, sensitive teeth.
So the bleeding gums go away, the bad breath go away?
Absolutely, absolutely, yes. And it's such a less invasive procedure than what we used to do. The old procedure works, but I just say to patients, we can do both, but why would we do the other? So another part of our practice, a large part, is treating people that have sensitive and painful teeth. And typically they have this because they have gum recession. And gum recession means that the gum is pulling away from the teeth. So they have bone loss. And if this continued on, they could lose their teeth. So the way most periodontists treat gum recession is they're taking tissue from the roof of the mouth. So they have to take tissue from somewhere else and transplant it. So basically you have two wound sites, two areas that have to heal. Well, in our office,
to get rid of the cold sensitivity.
Yes, to get rid of the cold sensitivity.
Yes,
yes, absolutely. To get rid of not only the cold sensitivity, but if you have a high lip line or a smile line, your teeth are going to look yellow because you're showing the roots. There's no enamel covering that, Randy. So I tell patients when I'm helping them understand why would they benefit by the pinhole graft, which is the procedure we just pull the gum down on the top, bring it up on the bottom. We can do that all in one visit. We can correct that. We couldn't do that and can't do that with the old way. There's only so much tissue on the roof of the mouth. So you just kind of
pull down the gums, no surgery?
Yes, yes.
And interesting. How soon does the cold sensitivity go away?
Immediately. That's really the neat thing about the whole procedure. Not only does a cold sensitivity go away immediately, they see the result immediately. With the other type of graft, it takes several weeks, usually sometimes up to 8 weeks, before they see that it was successful. This, they pretty much see immediately. And, that's really exciting for a patient.
So for gum recession, you don't do the old, or the other part where they, I guess, transplant from the roof of the mouth?
From the roof of the mouth.
So you don't do that anymore?
I would 99% of the cases we're able to do this pull down or push up grafting. Yes, the minimally invasive way. We're able to do that on 99% of our patients. Another procedure that we offer our patients is reducing the excess gum tissue. I'm sure you've been speaking with somebody and they smiled and their teeth look really tiny. And you see all this gum, and it's almost distracting when you see them. Well, we have a procedure in our office where we're able to gently recontour the gum tissue. Most of the time their teeth are, they're just hidden under the gum tissue.
So these gummy smiles,
yes,
you just take care of it with a laser.
We can use a laser. Sometimes we do use a scalpel, but it's very, very low on the threshold of discomfort. I tell you, one of the first patients that I ever treated, she didn't come to me for this. She had a periodontal infection. And as I do with almost every patient, I ask them, when I'm doing the exam, I say, if there were anything about your smile that you would change or your teeth, what would that be? She says, I hate my smile. I've never liked my smile. So when she looked in the mirror, she didn't like her gums. There was so much of it. So we brought her back after the other periodontal issue had healed, and I did half of the mouth. I took a picture. I put it up on the screen. I let her see it, and a tear came out of her eye, Randy. It was incredible. This is the kind of thing I get to help people with every day. And so we were able to do her whole mouth. I took a picture of the whole mouth done. And you know what she asked me at the very end? Why didn't somebody tell me this before? This could be done. Of course, there really isn't an answer to that. I don't know. But we were able to help her. She was 54 years old. So she lived her life with this gummy smile, not liking to smile, not liking her teeth. She was an attractive person. So this is just a neat area where we're able to help people. So for people like this that don't like their smile, they can come in. We can take a look at them, and they can know at the end of that evaluation that we can help them change their smile so that they're not kind of
So like one afternoon, was it take a couple of hours?
Probably an hour. It's all done in an hour, Randy.
And you do sedation, right? Are these people?
Yes, we do oral sedation where we make people comfortable and they oftentimes fall asleep. We have massaging chairs, we have headsets, masks. We want to make them comfortable. We know that they're anxious about whatever they're coming, even if they're just coming for their exam, they're usually anxious because they know most of what I do for surgical procedures.
Nobody likes the dentist, right?
And
they know they're in big trouble when they go see you.
They get to
the
me,
periodontist, the specialist,
right.
You're in trouble.
Yes, that's what they think, yes. Okay. But we give them hope.
So moving on to today's topic, dental implants.
Yes.
The people that are coming in for dental implants to replace missing teeth, who's the typical patient?
Well, it would probably surprise you. The typical patient ranges anywhere from late 30s to the 80s. These are people who are about to or have been told they need to lose all of their teeth because of periodontal disease, or they're already wearing a painful denture or partial, and they're suffering because it doesn't fit. They get sore spots, they can't smile, they can't eat ribs or corn on the cob or an apple like you and I can because we have our teeth. It's hard for us to really imagine what it's like not to be able to do some of those things that I take for granted every day when I go to a restaurant. I look at a menu. I don't think, oh gosh, I can't eat this because my teeth are going to fall out or because I'm going to get seeds underneath it. I'm going to have to slip away while I'm having lunch with you because I've got to clear this out. It's hurting me. I mean, that's what my patients are coming to me for. They want relief from that, whether it be they want to be able to eat or socially. I mean, I live in a community where we have a good number of older senior people, and they're very active. And imagine not being able to, or just deciding, I'm not going to go out and do this because everything revolves around eating at some time.
Yeah.
And so they're not able to do that. And so they don't go. And so they kind of become like a cloistered monk. They stay in and they don't go out. And it's really sad. But
I think you've told me that in your office, people can walk in on the day of the procedure, no teeth,
yes,
and walk out with a full arch of teeth that don't come in and out.
Yes.
That happens?
That happens. Let me explain to you kind of how that happens. So in our office, we have a cone beam x-ray. Takes the x-ray in 3 dimensions. This allows us to see if the patient is a candidate, which 99% of the time they are, and we can format everything so that they can get their teeth in one day. So that initial evaluation is where we determine that. Okay. And we can have a lab person oftentimes comes in and helps us help them get their teeth that day. It's amazing.
At the top of the show, we said no more dentures, right? Nobody should be wearing a loose-fitting denture. You don't like dentures.
Well, I see so many patients, Randy, that are suffering, that are wearing their dentures, whether it be because they can't eat what they want. They don't go to activities. They don't go to graduations. They don't go to weddings. They don't do they may not date. You know, I've heard it said the denture is the dirty little secret, you know, that they're dating and they don't want their, you know, significant other to know. I've had patients, Randy, that we've helped with implants that their spouse doesn't know they have a denture. So right? that's how big of a deal it really is. And I know to people that have their teeth, we can't relate. So we see so many people that we're able to reverse that process. They're able to get their life back. I have a patient.
They get permanent teeth.
They get permanent teeth.
All right.
So let me tell you about a patient, Cheryl. She came to me. Her whole goal was, my daughter's getting married, and I want to be able to go to the wedding. I want to be able to smile. I want to be able to eat. And I'm going to be in all these pictures. And right now, I'm embarrassed about my smile. I mean, it kind of breaks my heart when I hear somebody tell me that.
Yeah.
And I think, I'm glad you came. We have a solution where we can fix this in one day. So we were able to help her by placing 4 implants on the bottom, and I believe 4 on the top. Her teeth don't come out. That's a full set of teeth. So now she has a full set of upper and lower that snap into place. And I asked her when she came back, I said, how did the wedding go? She said, I can't tell you what a relief I had, because I wasn't worried about my teeth falling out or how they looked. I smiled in the pictures. I ate the food they had at the wedding. I mean, that gives me
nice.
Such, oh, Randy, I mean, you're helping somebody and you feel great and you know that they are so happy. I mean, it's like life is coming out of them.
Is this the future of dentistry where, you know, whether it's 10 years or 50 years, nobody will be wearing a loose-fitting denture? That means they'll always be attached to something. Is that what you think?
If I
Someday?
have my way, Randy,
right.
We're trying in our town to eliminate people that are suffering with dentures and partials. Yes.
Okay. Are there a lot of people, by the way, like in your area with dentures?
Yes. Now, I live in St. Petersburg. It's a town of maybe 250, 300,000 people. We have a professional football team, the Tampa Bay Buccaneers. We have a stadium, holds about 65,000 people. We could fill that stadium easily 4 times over with people who are about to lose all of their teeth or people that are wearing an upper or lower denture. You know, it's estimated that there are over 40 million people that have dentures. That's a huge problem,
well,
Randy.
But if it's so good, okay, so getting it fixed or attached
Right.
by dental implant, why aren't they all doing it? What's your take? They don't know? I mean, what is it?
Well, I think there's a number of different reasons from what I have seen for doing this over 25 years. Number one, if you have a denture, well, if it's okay with you, I want to back up and tell you what a person who's wearing a denture's life is kind of like. So imagine before they got to that point, they've had fillings, they've had crowns, they've had root canals, they've maybe had periodontal surgery, and these things have failed. They probably had 30 or 40, 50 dental appointments. Okay, so they've had 40, 50 dental appointments, and things keep breaking on them. So they're frustrated, and they kind of say, you know what? I remember, you know, Uncle Joe had a denture and he seemed fine. I'm going to get rid of all these problems. I'm going to have all my teeth out and I'm going to get dentures. I won't ever have to go to the dentist again. I won't have any more problems. Well, part of that's right. They don't go to the dentist anymore. So that's the biggest problem. They're not in the dental office anymore.
So nobody's telling them to do it, so these dental lawyers aren't coming in.
Right. So
or they're afraid, obviously.
They're definitely afraid.
Interesting.
But really, nobody's telling them. They may go to the dentist because they have a sore spot, because dentures aren't comfortable. I mean, we see in commercials all the time about these different pastes because people their dentures don't fit. So it's out there. So they're uncomfortable and they can't live a life like they would want to. So what we're able to do is we're able to help them with either a fixed or removable type of implant-supported prosthesis, replace their whole teeth.
It's like a snap-in, snap-out set of teeth,
Exactly, yes,
fixed.
or fixed. So, but that's the one thing. They're not getting told they need that. Sometimes they're going to the dentist, but maybe the dentist doesn't know what we can do. They're still sort of back 25 years ago where, you know, they didn't think you had enough bone. Or the patient heard that 20 or 30 years ago.
But isn't it true, though? I mean, if you've been wearing a denture 20 years, 30 years, you don't have enough bone.
No, that's not true. That was true in 1975, maybe, with the technology that we had. That's what they're being told in their office, that they don't have enough bone. But we have the CT scan. We can determine that they do have enough bone. 99% of the patients that I see have ample bone.
Have you ever had to turn somebody away and say, you know what, there's nothing we can do for you?
I would say maybe 1 or 2 out of thousands. So it's such a small percentage of the population that can't be helped.
Now, what about age? How old can you be to do this?
Well, as a periodontist, Randy, typically a lot of my patients are sort of on the older side in a sense. So I have patients that are in their 80s. I actually even have a patient who was 91 when I did implants for her.
Really?
Yes. So
are they more likely to fall out when you're that age?
Not at all. The
Statistically?
No. The statistics are, here's an interesting statistic. The Mayo Clinic says people that have teeth live longer, healthier lives. And I believe having implants are just like having teeth, because what that study revealed is they were able to eat healthier.
Like chew their food, obviously.
Chewed their food. So many of our patients come, they have stomach problems, they're taking medications because they can't chew their food up well, and so we're able to help them. They can then eat again.
So when they have like a fixed set of teeth on the upper and lower, supported by dental implants, could they eat like a carrot using their front teeth?
Yes.
Or like broccoli or whatever?
The only thing I might tell them not to eat would be like taffy. But that's really not, most people, I don't even remember if I've ever had anybody ask me, can I eat taffy?
So like chewing pizza or popcorn or whatever?
You can eat a carrot, you can bite into an apple, you can eat steak. Really, your menu just opened. I mean, imagine yourself in the denture where you have like a paragraph of things you can eat. We've just given you an encyclopedia of things that you can eat. Their limitations are so remote that I don't think it's even going to be an issue. I haven't had a patient, I can promise you, ever coming back to me that said, but I can't eat this. So
when it's all done, do they say, you know, I should have done this years ago?
Yes, yes. And you know, that's really the thing that I get the most joy out of, because I hate to see people that are regretting something, a decision they didn't make. And most of the people who have dentures regret that. There might be 5% of the population that get along just fine. That's a pretty small number. So 95% of the people that are wearing dentures, if they had a choice, let's say if they knew there was a choice that could change their life, then they would take it. Because people come into me almost every day and say, I wish I'd have done this before. And so I say, you know, the great thing is you're here now. Don't worry about what you couldn't do. Your life is going to change when this is fixed.
Now, I interrupted you earlier about the 91-year-old.
Yes.
So 91-year-old comes in to get it done. I mean, what about downtime for them or pain for them?
Well, if I can back up. So she was a patient that originally came to me at a much younger age. She was 88 when I first saw her. And she had all of her teeth. Wonderful woman. She owned a bookstore in town and she read to kids. So her motivation was she had bridges on almost all of her teeth. She had a bridge on the top that was failing, Randy, and so she couldn't have a new one. So she told her dentist, I don't want to have a partial. I'm afraid I'm going to talk funny if I have that, and I certainly don't want to go without my teeth. So he referred her in, and we were able to place 2 implants, and she had a bridge. She was great. I saw her 3 years later when she was 91. She had the same thing happen on the other side. And no.
So you did it again?
We did it again on the other side.
So it's like getting your teeth back, really.
It's like getting a 3rd set of teeth. You know, we have our baby teeth, they come out. Then we have the 2nd set of teeth, and sometimes we're not as diligent, or maybe they grew up in a time. You know, I hear the story oftentimes, well, you know, my parents just sent me to the dentist just to take the tooth out, or we didn't have the money at that time. And now they're ready to take care of themselves. And so they're able to do these things. It's wonderful.
Your office, I guess we should mention, is not the typical office, right? I mean, you even give people a comfort menu.
Yeah, so that means we give them an eye mask. We give them Bose noise canceling headset. We give them a blanket if they're cold.
So they just pick whatever they want.
Pick a massaging chair, whatever they want on that menu, they just point to it
and we get it for them. So a massaging chair while they're getting it done?
Yes, yes.
That goes up and down their back?
It's not like, but yeah, it's very light.
All right.
Most of the patients love it. They're like, ooh, wow, can I take can I take this home?
And most of these people that you're doing the implant on, they're lightly sedated?
Yes, yes.
So it's they don't feel anything, obviously, during the procedure.
That's one, that's a good question, because a lot of people wonder that. Do I have to go out? So a lot of the patients actually that we do this on, they don't want to be put to sleep. You don't have to be put to sleep. What I do, we get the patient numb and I tell them, here's the agreement we have. If you feel anything, You raise your hand. I will stop immediately. Feel anything? Raise your hand. You have to know that you're going to be comfortable here, or if for whatever reason the anesthetic starts wearing off, you just let us know. You're not going to have any pain during this procedure. We're going to make sure with everything within our power that you're going to have a great experience.
Now, for the sake of time, and I have to cut in here because I have questions about the dentures, but 4 implants, and you could give them a full arch of teeth.
Yes.
Is that right?
Yes. So let me explain that a little bit, because you asked the question, about people and what their reservations are. Why don't they all come in if it's great? So they count up they look at their denture and they go, wow, this has 14 teeth on the top, 14 on the bottom. That's 28 implants I would need to replace my teeth. That isn't correct.
Okay.
4 to 6 implants per arch could give you an entire set of teeth, could give you that 14 teeth per arch, snap in or fixed. So it's incredible. So they are thinking, wow, this could be over $100,000 if I need, 28 implants. That's out of the realm. That's way out of the ballpark. It's not anything like that. So that's the great news.
So it can be affordable. And people need to know, because they will email us, by the way, about how much is this or whatever.
Sure.
But insurance doesn't cover this. Medicare doesn't, the whole procedure.
Right.
Medicare doesn't cover it, Medicaid or whatever. But I guess you have financing available for people with credit, things like that.
Yeah.
You'll work with them.
Absolutely. So that's a good question. So just one minor correction. So some insurance will cover a part of it. But again, this is an investment. This isn't, a $200 procedure. So this is an investment, but their insurance typically will cover whatever their limit is. Not
so
medical
like a couple of $1,000 max payout or whatever.
Absolutely.
Okay.
But, I tell patients, this is like a coupon. Somebody's giving you $2,000. That'd be great. I'd smile and say thank you. So we work with their insurance. We find out before we ever get started. We have a saying in our office that we're going to inform you before we ever perform anything. So you're going to know everything. You're going to know the financial part, because we don't ever want that to get in the way. We want to make sure that you're comfortable with that. And we do. We offer financing. We offer 0% financing for up to a year. So that really helps a lot of people.
With good credit, obviously.
Yes. Okay. You have to have good credit, but that allows a lot of people, the door opens to a wide group of people.
In regard to the denture work. So if a patient comes in, they're wearing a denture, or they have to have all their teeth removed, and now they're going to talk about dental implants, what are their options? What's that conversation like when they go there?
Okay, so we have 2 primary options that we give to our patients. I brought the models in, if I could show them to you. Okay, so the first, we have talked about what we call a snap-in prosthesis. So this may look a little bit like a prosthesis. So this is an upper, okay? But what you notice, Randy, you may not know what a denture looks like, but a denture would be filled in the roof of their mouth. So they have all this stuff up there that stops the way they can talk. But this is snapping in. I'm pulling hard, okay? And what I want you to hear is this.
All right, let me think.
Okay, you try this.
All right, so this is, okay, I'm not exact. Okay, so it's hard. Is it ever too hard for them to pull out? Especially if you're older, 75, 80?
That's a great question. So here's the neat thing about this. This is customized. So say I have an 88-year-old person, arthritis. We can change their little caps inside the prosthesis. We can make it looser or tighter. So it's not just one way to do it.
So just snap in,
it just snaps right in there.
No more adhesive at all.
No more adhesives, no more paste, no more sore spots. So this is very common. A lot of people like this. But this is just like your teeth. This is fixed. This is what you may have heard of, the all-on-4 teeth in a day. This is what we're talking about when we say you get your teeth in one day. So with 4 or 6 implants, we're able to replace all of the teeth. So there's 14 teeth on here. So there's 6 implants in this model that I show patients. There's nothing in the roof of the mouth. You'll see there are little holes in here. The holes aren't there. They're just for demonstration. That's how it's attached to the implants. This doesn't come out. I'm not even going to give it to you, but it's
So it's like their own
solid.
teeth. So after like a week or so or 2 weeks, they forget they even have it?
Absolutely. They forget the denture because they're so happy that they made the decision to do this.
You say you transform people's lives, or you see transformations every week in your practice.
Yes. I have a patient, she's a local real estate agent out on the beach near where our office is. And she told me, she said, my wearing a denture has affected me being able to sell. obviously as a real estate agent, she's having to speak with people and you get kind of close to them and you're with them a lot. So she said, I don't smile. I'm embarrassed about my smile. I've lost my confidence and it's affected me. So we gave her 4 implants and gave her a full set of teeth. So after this was all done, she said, Dr. Crawford, thank you. You gave me my smile back and you gave me my life back. I mean, you know, my day doesn't get any better than that, Randy.
Patient watching this, they've been told your teeth have to go, right? And I know you use lasers, so if they have bleeding gums, bad breath, and their teeth are loose, you also take care of that. And then the denture wear, they're watching this. But they're still skeptical or afraid or whatever. What do you tell them?
Just come in. It's very simple. You can come in for a consultation.
Free consultation?
It can be a free consultation where you come in, we'll take a look at you, we'll ask you what are your desires, what do you want? What do you want this to achieve? So we can tell you what's going to be best for you. It's not just we only do this one thing. We're going to customize it to your needs and your desires so that when you're done, we know you're going to be satisfied because we know what's going to be best for you.
Now, we haven't talked a lot about your training at all, and even 25 years practicing. I mean, you've had a lot of training, you told me, with dental implants. How many years have you been in and around dental implants, studying this procedure?
Studying this procedure, wow. It goes back to my training at my residency at Boston University. In 1990, I graduated. Back then, implants were kind of a burgeoning field, but at our residence, we were able to have all kinds of speakers come in. I got so excited about what they were doing then. I can't believe what I was excited about then compared to today. So I have a study club in our area. I help teach local dentists about what implants can do, how they can change people's life, give them confidence in their smile back. And we do it for hygienists too. And the newest thing, Randy, that we're doing, we actually have seminars for the patients. They can directly come into our office.
So they could go to your website, find out the dates of the website?
Absolutely, they can do that.
Meetings?
Yes, yes. And so they can, it's very non-threatening. You know, we don't sit them down in the chair, they're just sitting out in our reception area. We talk about implants, they get to ask questions. Oftentimes we'll have a patient who comes in who's had it done, and they can talk to them. I mean, because who better can relate to a patient than someone who's already had it done? And so we're doing that. I'm always going to training. By our implant company that we work with, I've been asked to test a new implant to help make things more efficient and effective for patients. So that's incredible.
So this is like in your blood. I mean, your dad was a dentist?
Yes.
Brother's a dentist?
Yes.
And you're practicing in the town you grew up?
In St.
You ever have a high
Petersburg,
school
Florida.
buddy or two come in?
Oh, yes, yes. I have, yes. That's always interesting. Yes. I do have high school friends that come in. Yep, it's great. It's great to be able to help people.
Okay, good. We're out of time. Okay, so no more dentures. And what about your gums? I mean, if you have bad gums, your teeth are falling out, you could still qualify for dental implants?
Absolutely.
We have about 30 seconds left, so that's not a problem.
That is not a problem.
Okay, good. Thanks for coming on the show.
Randy, thank you for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.